Farrah Nicholas. Today I'm going to be doing my NG tube insertion and feedings video. So prior to going into my patient's room, I'm going to ensure that I verify my doctor's orders and gather my equipment. Once I do that, I'm going to enter the room, verify my patient by checking name and wristband. Hey Mr. Mouse, can you tell me your name and date of birth? Compare it to the wristband, making sure everything matches. Then I'm going to perform hand hygiene and put on my clean gloves. Once I have on my clean gloves, I'm going to ensure my patient is in a high Fowler's position to prevent any aspiration. Once I see that he is in a high Fowler's position, then I'm going to check the patency of his nares and make sure they're both good. Whichever one is better is the one I'll use for the insertion. And then I'm going to measure how far I need to put in the tube. So I'm going to go from the nose, the bottom of the ear here, to the xiphoid process. And then I'm going to mark that with a piece of tape. So I have my tape, boom, I have my tape on there. So once I've done that, I'm going to lubricate with some jelly, 3 to 4 inches. I have that here. I'm just going to dip that in there and then apply the drape. And then remove it. And I'm just going to tell my patient, put your chin to your chest and swallow to ensure that it does not go down the wrong pipe. So I'm going to go in, insert all the way to the point that I said here. Once it's there, I'm going to secure that. So there, just like that. Alright, once I have that secured, I'm good to go ahead and start my feedings. Prior to feedings, I need to check my doctor's orders, and I also need to verify placement. So you can verify placement by getting some residual, checking the pH with a pH strip, or you can get a chest x-ray. Chest x-ray is the best way and most secure to ensure that it's not in the lungs, but you can do it either way. So once I've done that, I'm going to go ahead and start my feeding. So remove the cap and draw up 30 mils. And there's many different types of feedings. If they're on like a continuous, or even if you're doing a bolus or intermittent, any of those, you want to check for residual first. So I'm going to pull it back. If I get less than 250, I can just put it back in there and continue with the feeding. But if I get more than 500, so 2 sets of 250, then I need to hold the feeding. So I'm going to go ahead and flush with my 30 mils. Once I've flushed, I'm going to perform a bolus feeding. So with a bolus feeding, I can just remove this, and I'm going to use this here. I'm going to connect it to the end, put the food in here, and every patient, depending on what their needs are, will get a different type of food. But you're going to hold it up just like this and let the gravity do the work. If they start having cramping or anything like that, you can come a little lower to help with that. But a big thing with this, you never want to push it. You never want to put this in and push it. It can cause extreme abdominal pain for the patient. So we're not ever going to do that. So once I've done that, I'm going to flush again with 30 mils. Let's see here. And then once I flush with that 30 mils, I'm good, and I'm going to go document which nair I use to insert the NG tube, the size of the NG tube, the type of feeding I gave, the patient's response, the type of gastric contents that I pulled out, and the amount of gastric contents. So once I've documented all that, I've removed my gloves, performed hand hygiene, I'm finished.